Welcome to Simsbury Voluntary Ambulance, Bloodborne Pathogens. This is annual training for all of our members, so sometimes a little bit dry, but important material nonetheless. So some things that we need to think about when we talk about bloodborne pathogens is, one, the requirement is that we go through this because it is an OSHA standard, and OSHA oversees workplace safety. And when we talk about bloodborne pathogens, we're required to go over just in general bloodborne pathogens that you could possibly be exposed to through patient contact, through interventions that you might do, treatments, CPR, first aid, all of those things. But we'll also talk about some site-specific stuff with regards to. So first we have to identify what a bloodborne pathogen is. It's just basically a microorganism that's carried in the blood. A lot of times when we think about bloodborne pathogens, we think about BSI and making sure that we have our body substance isolation on. We also need to think about other things that could be carried in other body fluids, such as mucus, saliva, tears, sweat, also semen, urine, and feces. So we do think, particularly when we talk about bloodborne pathogens, we're talking about microorganisms in the blood, but we also have to think about the other things that are carried in other wet solutions within the human. Kind of like the yuck factor, ew. So here are some common pathogens that cause disease. So malaria, syphilis, hepatitis, and there's different types of hepatitis, and that's one of the things that I really want to touch on here when it comes to healthcare workers, first responders, and EMTs and paramedics. A lot of people think that maybe HIV is easily transmitted, more commonly transmitted, something that we really need to worry about. And it's not to say that we don't have to worry about HIV, but there are some avenues in which HIV needs access into another person's body to really for it to take hold. Whereas with our hepatitis, the same type of access into another person's body has to occur, but it occurs much easier. So we're finding that more healthcare providers are testing positive for hepatitis. There's a couple of hepatitises that we can vaccinate against. Hepatitis B is one of those. That's a 3-series injection. Hepatitis C is more of the detrimental, no vaccination. However, there are some new meds on the market, one called Harvoni, which just came out about a month ago. It's a very expensive medication, but it's got a really good cure rate for hepatitis C. It's about a 3-month course of this medication. The pill is about $1,000 a day, very expensive, obviously. But a year ago when I gave this lecture, this particular drug, Harvoni, was not on the market. But hepatitis C is a big deal when it comes to healthcare workers. The problem with hepatitis C is it really does do tremendous liver damage, can lead to cirrhosis of the liver and cancers of the liver. So that's why we want to think about protecting ourselves from things. The other thing that I would add here is, Ebola. We have separate Ebola training, which won't be covered extensively in this particular PowerPoint, but I do have a separate PowerPoint for that, and we have gone over Ebola training within our. So let's talk specifically about some of these conditions. HIV, it's a virus, which means it's not going to respond to any antibiotics. HIV is just something that can be found in the blood. People that are positive for HIV may not be and will not be symptomatic. They just tested positive for the virus's presence. AIDS, immunodeficient disorder, AIDS is the full-blown symptomatic portion of HIV. So someone who is HIV, they can be asymptomatic for months to years to decades, and then all of a sudden develop the symptoms, which then moves them out of the HIV status into the AIDS status. What HIV does is it just basically really screws with the immune system, particularly your T3 and T4 cells, and it gets them all discombobulated. So therefore they can't respond to foreign invaders within the body, and they don't recognize these foreign invaders. So it makes people prone to what we call incidental infections. So their immune system does not protect them from the common cold. It doesn't protect them from cells that can become cancerous. It doesn't protect them from lung infections, things that we can easily, as healthy people with a healthy immune system, can easily, defend against, because our body is wired very well for that. But with the HIV, the wiring or the immune system, the wiring gets all screwed up, and the body can't protect against these, simple incidental infections. So with HIV, it doesn't survive well outside the body at all. Dries up pretty quickly. And as long as the blood is dry, it's not an issue. It doesn't have the ability to survive outside a human host. The other thing that you need to think about is, how do we get HIV? You really have to have some intimate contact, or really some good exchange of blood or body fluids in order to contract HIV. So a little drop of blood from an HIV patient on your hand or skin really is not a big deal. You probably HIV through that. Really, you have to worry about the open wound or the needle stick into a vein, or maybe you've gotten it into your eye. So what happens is, if you feel as though you've been exposed to something, you're going to meet with a doc who's going to go through the patient's risk factors, your general health, how you were exposed, and whether or not the route would be conducive to developing the disease. Now, when we talk about hepatitis, that's a big deal. A lot of people have hepatitis. People walk around with a chronic infection, just kind of flying low under the radar. They may not be symptomatic, but they do have hepatitis within their system. Problems with any type of disease that affects the liver is that it can lead to liver disease, cirrhosis. The liver is a terrific organ. It can regenerate itself. It's got about 230 different functions. And it's got wonderful cells that can repair and rejuvenate itself if need be. But if the disease goes untreated, undetected for a significant length of time, it can lead to liver disease. It can lead to cirrhosis, cancer, and cancer to liver usually follows a fatal outcome. So we talk about death there. But since 1982, we've had a vaccination available. And so that's something that, if you have not been vaccinated against hepatitis B, then you should consider doing that. I think most people now are vaccinated. They're vaccinated as infants. So your hepatitis B virus, HBV, can survive for at least 1 week in dried blood. So that's something that we need to think about in the back of the ambulance, because occasionally we have some dried blood. We come in, we want to wipe down the ambulance. We want to wipe it down with a good Cavi wipe. We want to let the Cavi wipe solution dry so that we can really destroy that virus. But if we rejuvenate the blood or make it wet again with water or saline or sweat, you've got the hepatitis B vaccine still active, and certainly can pose a risk. So some symptoms of patients that have hepatitis B, and maybe they've not known that they've had it, and all of a sudden they develop, some fatigue. They don't feel well. They're kind of weak. They've lost their appetite. They're feeling nauseous, maybe vomiting, abdominal pain. Well, that sounds like a lot of different vague complaints that we have. But one of the symptoms that we look for is the jaundice. You can see the jaundice in the fingernails, in the skin, in the eyes, even the mucous membranes. Anytime you see jaundice, that's the breakdown of bilirubin. And when it breaks down, it produces bilirubin, so it's the death of blood cells. And so when your skin becomes this yellow or jaundiced, liver disease, especially if it's coupled with those types of symptoms. Hepatitis C, that's another issue. It's a very common chronic illness within the United States, particularly in healthcare workers. Again, the symptoms including, the fatigue, the abdominal pain, just not feeling like you want to eat, intermittent nausea and vomiting, just feeling like something's just lingering and you really can't get over it. And then as weeks go by, jaundice develops. And when jaundice develops, then we know we probably have a pretty significant liver issue going on. As I said earlier in the first slide, hepatitis C has no vaccine, still doesn't have a vaccine, but it has a medication now, Harvoni, which can treat it. And so these patients go on this medication, daily medication, about $1,000 a pill per day, and I think it's a 3-month course, but I'm not completely positive. I think it's 3 months of the medication, and patients that are taking the Harvoni do actually respond very well, and the hepatitis C is treated very well that way. So what are potentially infectious bodily fluids that we need to think about? I talked about bloodborne pathogens, and we only think of blood, but I also talked about early on when we first began the presentation that we have to think about saliva, we have to think about urine, we have to think about sweat and tears, semen, vaginal secretions, and vomit. So that's anything that's liquid that comes out of the body. We have to worry about it possibly being contaminated, so we need to, and that's where our body substance isolation comes in. Now, if we've protected ourselves, we could still potentially have an inadvertent exposure. So we look at, what is the potential for transmission with certain body fluids. So contact with another person's blood, we inadvertently touch them, don't realize it, and maybe they've fallen in the bathroom, we go to pick them up, and we look down and we've got body fluid on us. Maybe they've coughed, maybe they vomited, maybe we didn't have any eye protection on or any face shield on, and now we've gotten it into our mucous membranes, and maybe they've spit, or maybe they're coughing up blood, maybe it's a nosebleed and it splatters and we get it into our eyes, our mouth, or our nose. That's the ick factor. And then there's other ways, maybe it's not skin-to-skin contact, but maybe it's some dried body fluids on the ambulance bench, or maybe it's on the end of a needle. So we have to think about ways that we can potentially be exposed to body substance isolation, body substance and bloodborne pathogens inadvertently. So I want to back up a little bit. We want to have our body substance isolation on so that we can prevent against these unintentional or inadvertent exposures of the surface being contaminated, of vomitus or secretions or anything getting on us. So we have to look at, and the only way we can protect ourselves is we have to look at the different ways we could potentially come in contact with So what's our exposure potential? Well, that all depends on where you work. So here in the back of a moving ambulance, and when we deal with sick people and we respond to 911 emergencies, our potential for exposure is obviously high. If we're working in an office environment and we're not dealing with patients, the potential is low. We just had somebody come back from West Africa, and they were evaluated for their exposure potential, and they found that their exposure potential was low because of the area in which the person was when he was in Africa and the types of people he was in contact with. Now, certainly your exposure potential could be high if you have direct patient contact and you're dealing with sick people. Be careful how we handle products. We have to be careful how we handle potentially infectious solutions, secretions, body fluids, and we need to make sure that we dispose of them properly. So first, it starts with us using proper PPE. That's personal protective equipment. Our personal protective equipment are our body substance isolation, BSI, which are our gloves, our masks, our gowns, and we have to make a decision based on each patient presentation to what degree are we going to gown up. So universal precautions is the stuff. It's the stuff we use to protect ourselves, the stuff that we use to clean up after we've had contamination either on a bench, a cot, how we clean up our trash cans, the bags that we use, how we clean up equipment that may have been potentially contaminated as well. So PPE in general is just anything that we use to protect an individual or a person from an exposure. So we talk about the different types of gloves, goggles, CPR mouth barriers we don't use anymore because we have nice BVMs, which also have a valve that protects us from anything coming back up at us or into the reservoir. But certainly, CPR has changed its thought about how they do things, where now it's really compressions only, and we're not seeing a lot of mouth to mouth because of the exposure to body. So some things to remember: always check PPE for defects or tears, because it's obviously not going to provide the protection it should if it's not in good condition. Get rid of it or remove it or replace it if you find that it is defective. And remember that PPE should only be removed in specific areas. You don't want to remove your PPE in a clean area, and you don't want to take it off in a contaminated area, because then you're exposing yourself. So there are some certain specific ways in which we don and doff our PPE. Most of our PPE here is disposable. We do have one item that's not disposable that needs to be cleaned, and that's going to be discussed in another slide presentation. And it's something that we use specifically for Ebola. And so I don't want to go down that line, but it is something that we will cover in another presentation. So let's talk about contamination of equipment, cleaning our surfaces. So we use Cavi wipes. Cavi wipes are terrific. They're very moist. They are toxic to the hands. You need to protect yourselves from them. You should always protect your hands with gloves when you're using Cavi wipes. You wipe down everything and you let it dry on its own. If it's wet, you don't dry it off with a towel, because then you're taking away its ability to clean and disinfect the way it's supposed to. We also have some spray in the ambulance as well, little site-specific stuff that really helps get into the nooks and crannies. And the spray, we would use for anybody that we transported with an airborne illness or an Ebola type of illness. That's really going to help us get into all of the crevices, particularly on the stretcher. And again, we're going to let that stand for 10 minutes, but we're not going to wipe it down when it's wet. We let it dry on its own. So hand washing, let's think about hand washing. How long are we washing our hands, and what are we using to wash our hands? So we want to get our hands nice and soapy. We want to sing the song Happy Birthday. That would be long enough to really get your hands clean. We have all kinds of songs in the medical profession. We have Staying Alive for CPR. For washing our hands, it's singing Happy Birthday. You want to wash your hands immediately once you realize you've had an exposure, flush, 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 or after removing any PPE. You want to use antibacterial soap of some sort, or a good hand sanitizer. Now, if you got a lot of stuff on your hands and you've got a lot of contamination on your hands, you really want to use running warm water and soap. If your hands are not contaminated with any stuff, using the little sanitizers is okay to get your hands clean until you can get to a sink and wash with soap and water. So let's talk about regulated medical waste. Those are the things that we're going to put in the red bag. So we have contaminated items or contaminated sharps. You're going to see this little biohazardous sign on it. It tells people that, there's biological waste in here, and so they have to be disposed of using a waste management company that has specifically been inspected to ensure that they have the proper equipment to dispose of it correctly. We, of course, don't. We hire a company. So we have our sharps containers, which are red, have this particular logo on them. We have red bags, biohazard bags, which is where we put soiled material. We have a washer and dryer here, which was never to be used for washing or cleaning contaminated items. It hasn't been approved or inspected for that kind of use. So if you have something that really is contaminated, your best bet is to put it in a red bag and throw it away. At the hospitals, they do have contamination receptacles, and you see them when you pull in, for instance, St. Francis. They have two types of trash cans out there, one for your biohazard, one for your regular waste. So, things that are completely soiled, in other words, wet, and aren't going to clean well or easily, goes in a biohazard bag. Anything that is sharp in a sharp item, whether it's a scalpel, a needle, glucometry equipment, anything that would puncture the skin that might have blood on it, that needs to be thrown in a sharps container. And then we have those things that are reusable with either a Clorox bleach solution, cavity wipes, submerged, rinsed off, dried out, and put away. Here's some examples of what our biohazardous containers look like for sharps. So we carry this large one over here, and then we carry a small little sharp shuttle that we keep inside the red medic bag. So we've sort of gone over what a bloodborne pathogen is. Just in summary, it's something that is in any type of body fluids. It doesn't have to be just blood. And it's some type of microorganism that could potentially contaminate a healthy person because you've been exposed to someone in such a way through vomitous secretion, sweating, tears, blood, and you have an open wound somewhere. One of the most common places where people have open wounds where they don't even notice it is right around the cuticles of their fingers, which is why it's so important to wear gloves. Sometimes you don't even realize that you have openings in your skin. So be aware. So if you think you've been exposed to something, there's a particular way here at Simsbury Ambulance that we want you to follow through. One is to immediately, obviously, wash the area. As soon as you can get to soap and water, use soap and water. If you've got a 10-minute drive and you've been exposed, go ahead and wipe off your hands with the hand sanitizer until you can get to soap and water. Then you're going to want to notify Mike. You're going to notify the senior person on your crew. You're going to do this both through telephone contact or text message, and then you're going to write out the incident and what happened. You also want to know the name of the patient so that the hospital is aware of who the patient is, and this way they can talk with the patient and get permission to run tests to make sure that they don't have any illnesses that could potentially harm you. It is up to the patient to say yes or no to that. The other thing is, once you've had an exposure, you're going to have an evaluation by an infectious control doctor. It'll occur usually at St. Francis. Mike will be able to give you direction once he's received your notification as to which hospital to go to. Obviously, if you're at the hospital, you've been exposed, you can drop off your patient and speak with the doctor on staff, and they can then forward the information over to the infectious disease doctor. What the infectious disease doc is doing, he's going to look at you, your general health, the patient that you brought in, what the contaminated solution was. Was it tears? Was it sweat? Was it vomit? Was it blood? How were you contaminated? Was it a needle stick? Was it a splash in the eye? Did it wind up in your mouth? Do you have any open wounds? And he's going to take all of that into consideration and look at the possible bloodborne pathogens that would be of most concern, which is HIV, hepatitis B, hepatitis C, and determine whether or not you're at a high risk for having an exposure or a low risk for having an exposure. And then the doc will sit down with you and advise you as to what should be done. One of the things they'll certainly do is they'll draw some labs. They'll get a baseline set of labs because they want to know what your blood has in it right now, because if you do develop symptoms 6 months from now or 4 months from now or weeks down the road, they've got a baseline set of labs and they know what your normal is. So certainly as a minimum, you're going to clean off the area, wash it with warm soapy water as soon as you have the ability. You're going to notify the senior person on your crew. You're going to notify Mike, all in writing, and at the hospital you're going to let the doctor at the hospital know so that they can at least start the treatment process and get permission from the patient to find out, to draw blood and find out if there's any possible issues. So everything that's done is confidential, obviously, and there will be a recommendation as to what your follow-up would be, whether or not they want you to start any antivirals. So if they feel like your exposure is a pretty significant exposure, they may want to start you on antivirals. or they may just want to follow you. And again, that's going to be between you and the doc, the infection control doc. So just going back to vaccinations, this is a good way to protect yourself as well, not just having the right isolation equipment on, but to get yourself vaccinated. So if you haven't been vaccinated, you should definitely do that. And I think most people here at Simsbury Volunteer Ambulance are. And I think even the college kids going into college are probably vaccinated by now. And again, the vaccination started way back in 1982. This does protect you. And obviously, if you don't have the ability to pay for the vaccination, it's a 3 injection series. But if you don't have the money to, if your insurance doesn't cover this, or you don't have the money to pay for it, this is something that's provided free of charge. You just let Simsbury Volunteer Ambulance know that you have not been vaccinated and you want to go ahead and get vaccinated, and you provide us with receipts. These are some things that you should have on hand. Your hepatitis B vaccination status. If you were vaccinated a while ago, you can definitely have a titer drawn to see if you're still reactive. Obviously, training on such things as bloodborne pathogens and your understanding of how we handle things in a site-specific way, and where our red containers are, where our biohazard bags are, when they're full, where do we put those? That's out in the garage where car 5 is kept. We have boxes that are labeled biohazardous material, and when our boxes become full, we call and we have a pickup schedule, and they're taken off the site. If there are concerns about anything you've seen in this slideshow, or you're confused, certainly contact me. I can sit down and discuss things more appropriately. There's also a list of site-specific stuff that are on the bulletin boards here, so that if you have questions about our site-specific treatment of contaminated items, certainly refer to that as well. So if you have any questions, let me know. Obviously, this is a one-sided conversation since this is not a live presentation for me to talk with you, but certainly let me know if you have any questions. There is a test at the end of this presentation. It's a very simple test. You'll take it online, and then you'll get a certificate upon completion. And again, thank you for attending the Bloodborne Pathogens annual training.